So if you're a patient who's having a hard time getting doctors to see past your weight, and that seems like the only thing doctors want to talk about with you, this is a piece of advice that I give my patients who are going to see a specialist that may run into this problem.
Now, this is not bad advice, and I do really like the creator who made this original video. However, I'd like to add on some additional resources because a lot of people are running into this issue with their primary care doctors, not just specialists. In fact, I've worked with several clients whose doctors would not refer them to a specialist because they were so fixated on the weight issue. And the problem is that when general practice doctors or primary care doctors focus so heavily on weight, it can make those routine care appointments feel terrifying. And most of the time, doctors provide this general diet and exercise advice without first understanding what somebody's current lifestyle actually is, understanding what their barriers are, and without doing any kind of screening for eating disorders, which makes advice like this useless at best and really harmful and detrimental at worst. Not only because if the person in front of them actually has an eating disorder, it will worsen that, but also because this constant discussion about their body size often leads people to delay or avoid care because they are sick of being told over and over and over again to eat lean proteins, eat vegetables, watch your portion sizes, exercise more, and oh, have you heard of Ozempic? They know. So I want to talk about some other things that people can do to increase the likelihood that they will receive weight-neutral care from their medical providers. Number 1. Let the office know ahead of time that you would not like to be weighed unless it is medically necessary and that you would not like to have your weight or body size discussed during your appointment. You can let reception know when you make the appointment, when they call to confirm the appointment, or you can let them know when you arrive at your appointment before you go and see your medical care provider. If that feels a little bit confrontational, you can also try sending a message through your healthcare portal to the office ahead of your appointment. Number 2, if they start talking about weight loss, you can politely decline to engage in that conversation. Remember that at the end of the day, you are hiring your doctor to provide you with a service. They are not your overlord. So if you don't want to talk about something, you don't have to talk about something. Number 3, if they start talking about weight loss and telling them, no, I don't want to talk about that, feels too confrontational or they're not respectful of that, the other thing you can do is ask for a referral to a dietitian. Dietitians have way more experience when it comes to lifestyle interventions and behavior change than even the best trained physician. And they can follow up much more closely. They can help you adapt your plan in real time, and your appointment times are going to be much longer. So they're actually going to be able to do an in-depth intake with you so that they know what you're currently eating and they know what your lifestyle factors and your barriers are. And they are a lot more likely to screen for an eating disorder to make sure that you actually get care that's going to support your well-being. Now, it's up to you whether or not you want to follow through on that referral, but asking for the referral and having them put that you asked for it in your chart and having them send it to you means that they've done something, and then they're more likely to move on from that topic. Number 4, if you have a medical condition and they're recommending weight loss for it, you could always ask your doctor how they would advise a patient whose body size was not a concern. You will more than likely get a different and more comprehensive set of recommendations. And number 5, if they just won't leave it alone, and I have absolutely had clients who have been in that situation, get a new doctor. If you went to a massage therapist and you said, hey, I don't want my legs massaged, and they went and they massaged your legs anyway, even though you asked them not to, and you said, hey, I told you not to massage your legs, if they kept doing it, you would get up and leave and you would never go back to that massage therapist. So how do you find a doctor that's more likely to be weight neutral? 1, ask other people in your community. So if you have a friend who's in a larger body size, or there are any groups or meetups for fat advocacy, you can always ask those people who they go to and what their experience has been. The second thing is you can look for other weight neutral, weight inclusive providers. So like therapists or dietitians, it's helpful to look for people who say that they are HAES aligned, Health at Every Size aligned, and you can ask them who their clients go to and what their experience has been, because more than likely there are probably dietitians or therapists in your area that know of a few doctors that their clients have had good experiences with. And number 3 is there are some directories out there for physicians who have elected to say that they are more weight neutral, weight inclusive. So you can just go into Google and search for weight inclusive healthcare provider directory. I know that Health at Every Size organization has one. I think that there are a couple people on social media who also post them, but you should be able to find it with the Google search. And my advice for healthcare providers, primary care doctors, specialists, etc., always ask before engaging in a conversation about what somebody's body looks like, because you don't know what their experience is. You don't know how triggering that conversation is going to be for them. You don't know what they've tried. You don't know any of that. And so it's always respectful to say, hey, are you amenable to discussing weight today? And if they say no, then you go, okay, great. leave it. And also, I would encourage doctors to refer out to a dietitian more often, because research shows that when doctors provide weight loss advice, it is less likely to be evidence-based, and it is also not very likely to result in long-term weight loss. But it is likely to result in that particular client avoiding care in the future. So don't waste your consultation time alienating your patient and not probably getting any benefit from it. Rather, why don't you pass the ball to a licensed healthcare professional that actually has relevant experience and training in that specific issue and actually has the consultation time to make some kind of meaningful impact. And instead use your consultation time to provide the lifestyle and the medical interventions to address their actual issue rather than trying to address their issue through the proxy of weight loss. You can improve your cholesterol, your blood pressure, and your blood sugar without losing weight. I don't understand why so many doctors, when somebody gets a diabetes diagnosis, tell them that they should lose a certain percentage of their body weight in order to improve their control, rather than actually tell them, hey, if you eat more fiber from fruits, vegetables, whole grains, and you do some movement after your meals, that can have a really big impact on your glycemic control. Because when you could take the first route of targeting weight, they're more likely to engage in restrictive diets, which are not sustainable, are not lasting, are probably going to have an overall net negative impact on not only on their physiology, but on their mental health as well. And now you have wrapped their entire diagnosis in a package of shame around what they look like and what they failed to do about it. Actually engaging in the things that are going to help them get better glycemic control may result in weight loss. It also may not result in weight loss, but overall taking that approach and just leaving weight out of it is going to have a net benefit for your patient. Hope it helps.